Blepharoplasty, one of the very best procedures in plastic surgery. It's a procedure where we rejuvenate the eyelid. In this case, we did the lower eyelids only. So you can see the really marked difference between the upper and the lower photo, the before and the after. And again, we only did the lower. This is at about 4 weeks post-op. And you can see kind of the real issues. I'm going to go through it step by step in terms of what we did in this case. So you can see that there's excess skin and bags of the lower eyelid. So you can see where the skin's kind of hanging down here. Then you can also see the bags. So there's fat as well as excess skin. So the question is, well, how do we get rid of that? So what we do is to remove the excess skin is that we make a little incision just under the eyelid. So you can see the redness under both the eyelids there. That's where that incision is located. So that will heal nearly scarless with time. There will be a scar there, but it's really tough to see. And that's where we get rid of the skin. Now, one thing I want to point out is that we can almost never remove all the skin. So if you see here on this this is his left eye, there's a little bit of a wrinkle that's still there. I just can't pull it tight enough to get rid of that. There's things we can do to improve that with time, but he is only a few weeks out, so it will likely just improve on its own. The other thing that we do, though, is to address the bags, is if you look right here, this line, so part of that is loose skin, but part of it is where anatomically where the eyelid ends and the cheek begins right here. So what we do is we go inside the eyelid, actually pull the eyelid down like this, and we make an incision inside the eyelid. And we go through and we free up the fat. And kind of an older technique, and I do this rarely now, but the older technique is you just take the fat out and throw it away. What I like to do is I like to remove the fat from here, not fully remove it, but free it up and then pull it down over the cheek. So part of the job is to remove the fat from the under eye, but to kind of move it down to the lower eyelid. And you can see kind of what we've done here. If we look at the lower eyelid here on his right side, we can see there's a little bit more fullness to the cheek. So here's where I'm talking about, kind of right in this area here. We've removed the fat from up here and kind of pulled it down to stretch it out there. So if you look at the cheek above and you look at the cheek down below here, there's a little bit more fullness there. If I move myself out of the way, you can maybe compare those a little bit more. His cheekbone kind of right here is just a little bit fuller on the after photo than the before. So again, we are very early out, but he's showing kind of one of the things that can happen. He's got a little bit of irritation of the conjunctiva, which is the lining of the eye. That will go down. Sometimes that can last a little bit longer than what we'd like, but that will go down typically with some time. We've been treating that with a little bit of steroid drops, but the main thing is just some time. That's going to be the best thing. The other thing that he's got here is a little touch of ectropion, which is when the lower eyelid is pulled down. He's doing some taping there. We're having him massage that. That's almost certainly going to get better with time. That's something that we always try to minimize as much as we can during the procedure. I'm going to point out something that I did in this case to try to minimize that. So if you look very closely at the lower eyelid in this photo versus the one above, if you look at the portion of the eye lateral to the iris, or the colored part of the eye, so what I mean by there is this portion kind of right here, and compare it to the portion of the after photo, which is right here, you can see that after photo, if you look just at that eye, that eyelid is pulled up a little bit higher than the other side. Or rather, not higher than the other side, but higher than the before is what I meant to say. So why do we do that? Well, that's called a canthoplasty, and it's where we tighten that lower eyelid up. So we kind of lift it up, we make a little incision for it. The procedure that I like to do is called a tarsal strip, where we take a portion of the tarsus, create a strip, and then we stitch that strip to the periosteum here. I did that on both of the eyes because he had a little bit more laxity. We often do this test, it's called the snap test, where we pull it down and see how quickly it bounces back. Some people it bounces back better than others, but if you don't do that, then it puts them at higher risk for that kind of pull down here. So if we look at his left eye, if we move myself out of the way here, we can see here that he's got a little touch of that right here. So I think that part of the problem is there's just a little bit more inflammation that's pushing the eyelid out and down a little bit, but also it could just be that perhaps my stitch here is not tight enough, or it may potentially came loose a little bit, where that's coming down. So we're gonna have to watch that and see. I think it's going to get better. I would say about 95% of these are going to get better just with time, with taping, and with massaging that up, as you just kind of help the body heal. But if not, it's a pretty simple procedure to fix. In the clinic, we just numb the area up, and we put a little stitch in there to tighten that up and lift that eyelid back up a little higher. So that's a blepharoplasty, and that's how we get a really nice result like this, where we have addressed that wrinkly skin and given this kind of a rejuvenated appearance. And you'll notice before, if you're like me anyway, you notice the lower eyelids quite a bit in the befores. You notice the upper eyelids a little bit less, but he could have used an upper eyelid procedure as well as probably a brow lift. His brows are a little bit low, so giving us a tiny bit of a lift right here and removing the excess skin would really give him a nice rejuvenated appearance. And when he's ready for that, we'll take care of that, but you know, one step at a time in most cases. I hope that's helpful. If you have questions, please let me know. But that's a lower blepharoplasty. I'm Dr. Ward in Salt Lake City, Utah.